Today, we're going to turn a pretty standard medical checklist into a full-blown detective story. We're going to see how doctors can solve these incredible mysteries of the heart using just their senses, often without a single piece of high-tech gear. So let's just dive right in. The physical exam. It's really a masterclass in observation. And it all starts with a question every good detective has to ask. How do you find the clues that are hiding in plain sight? Exactly. You have to think of the doctor as a detective, and the patient's body is the scene of the mystery. Your job is to systematically find, collect, and then figure out what every single clue actually means. Now, any good investigation has a protocol, right? A specific way you start. For a doctor, this whole thing kicks off from the end of the bed, before they've even laid a hand on the patient. The very first step is a simple but absolutely critical checklist called WIPER. It's things like washing your hands, introducing yourself, getting permission, and positioning the patient correctly. This isn't just about going through the motions. It's about respect, and it's about preparing the scene before the real detective work can begin. Okay, now it's time for the first sweep of the scene. Using the ABCD guide, the doctor scans for those big, broad clues. They're looking at the patient's general appearance, their body type, their skin color, checking for any paleness or that bluish tint we call cyanosis. They're looking for any signs of distress and checking for any medical equipment that's attached. These are the very first leads in the case. All right, so with that initial survey done, the investigation gets up close and personal. It's time for the hands-on examination of the physical evidence. And this is where it gets really interesting, because you would not believe how much the hands can tell you about the heart. We're talking about everything from the shape of the fingernails to tiny spots on the palms. Every single one of these is a potential clue pointing to a very specific condition. For example, take clubbing. This subtle change in the fingernails is a classic sign. It tells our detective that there might be a chronic problem, a long-term issue with oxygen getting around the body from the heart and lungs. I mean, think about that for a second. Your fingernails are telling a long-term story about your heart. It's an incredibly powerful clue from a place you might not think to look. So, after the hands, the investigation moves to the pulse. And believe me, this is so much more than just counting beats per minute. The pulse is like the heart's own unique signature. And the way it feels, well, that can reveal a ton of information. The doctor isn't just checking the speed. They're feeling for the rhythm. Is it steady or is it all over the place? The volume, is it strong and bounding or is it weak and thready? They check both arms to make sure it's symmetrical. And most importantly, they're feeling for any kind of special character. And this is a perfect example of what special character means. The feel of the pulse itself is a huge clue. A collapsing pulse, one that feels like it's jumping up and then suddenly dropping away, could point to something like a PDA. On the other hand, a slow rising pulse might suggest a narrowing of the aortic valve. It's basically like fingerprint analysis for your circulatory system. So you see, the search for clues is it's all-encompassing. The detective moves from the hands and pulse up to the face and neck, still looking for clues like paleness or that bluish cyanosis again, or maybe even some unusual pulsations in the neck. Every part of the body might hold another piece of the puzzle. And now we get to the chest. This is the heart of the matter, both literally and figuratively. All the clues we've gathered so far have been leading the investigation right to this spot. The chest exam follows this really strict logical sequence. First, you inspect. You just look. You're looking for things like scars from old surgeries or any pulsations you can see. Second, you palpate, you feel. This is where the detective uses their hands to gather those tactile clues. And finally, you auscultate, you listen. Let's talk about palpation for a second. When the doctor puts their hand on the chest, they're feeling for really specific things. A thrill is this buzzing vibration, almost like a purring cat, that tells you there's some seriously turbulent blood flow happening. A heave is more of a forceful lift against your hand, and that suggests the heart is working way too hard against high pressure. And now we get to the moment everyone recognizes, listening with the stethoscope. But this is not just some routine step. This is the culmination of the entire investigation. All the other clues have led to this moment, where the detective gets to listen directly to the story the heart is telling. So what are they listening for? Well, first there's the normal lub-dub sounds, what we call S1 and S2. But they're also listening for anything extra, any clicks or other sounds known as S3 and S4. And of course, they are listening very, very carefully for murmurs. So what even is a murmur? Well, it's basically the sound of chaos. It's a whooshing noise that happens when blood flows in a turbulent, abnormal way, usually because a valve isn't working quite right. Describing exactly where, when, and how that murmur sounds is one of the most critical clues a doctor can find. Okay, so the evidence from the hands, the pulse, and the chest exam is all in. Now it's time to put all the pieces of this puzzle together and actually build the case. But the investigation isn't quite over yet. A good detective is thorough, right? So they do a final check of the back, the abdomen, the legs, looking for signs of things like heart failure or checking the pulses in the legs to make sure there's no delay. You can't leave any stone unturned. And finally, the detective writes their report. They take all these individual findings, the clubbing, the feel of the pulse, the location of the heartbeat, the sound of the murmur, and they synthesize them. This is how you transform a long list of symptoms into a single coherent story. It's pretty amazing, really. What started as just a general look from the other side of the room has now narrowed down through this careful, systematic investigation into a highly specific story about one person's heart. And all of these different clues, the things you see, the things you feel, and the things you hear, they all come together to create one single comprehensive picture of what's going on, often giving you a pretty clear diagnosis before a single advanced scan is even ordered. It's just a powerful reminder that, even in this age of incredible technology, sometimes the most sophisticated diagnostic tool is just careful, methodical, human observation. Which really leaves you with a fascinating question. What other stories is the body telling us if we only know how to look?